I'm Tanja Popovic, and welcome to Beyond the Data. Here with me is Dr. Wanda Barfield. Wanda, we have just finished a great session on reducing the teen pregnancy rate and have heard a lot of interesting and valuable data. And while it is encouraging to see that the rates of teen pregnancies are declining, there is certainly a lot of room for improvement. And what I would like to focus on is different groups of people who can help us further improve the decline in those rates, such as healthcare providers, parents, and teens themselves. So let's start with the healthcare providers. What can they do to gain teens' trust and have teens open up and be comfortable talking about contraception?
Well, thank you, Dr. Popovic. I think one of the important relationships that providers have is the honor to learn about confidential issues. And so I think in the context of teen pregnancy prevention, providers really have an opportunity to really earn the trust of teens and to learn about the particular issues that affect them. I think providers in particular, when you think about, for example, pediatricians, they may have a longer term relationship with teens and may be able to start to introduce the issues of sexual activity and sexual risk behavior. So it's very important that we also learn to train ourselves as providers on how to talk appropriately with these controversial areas.
What does it mean to have a teen-friendly office in which one is comfortable to talk about it?
I think we could probably do a better job of even asking teens what a teen-friendly environment is. We know from some of the information that some of it is also about maintaining that confidentiality in the clinic, perhaps having appropriate triage areas depending on a condition, and allowing an area that really fosters more that transition into adulthood. So they may not want to go to a clinic that looks like it's serving babies, or they may not want to go to a clinic that looks like it's focused more on other activities like STD prevention. So I think communities have an opportunity to learn from their teens as to what might be a best environment for them.
So asking them as well.
Asking them as well, yes.
So we have also heard that a lot about LARC today. Can you summarize for us what are the key advantages of using LARC?
Yes.
And what are they?
Yes, so LARC stands for long-acting reversible contraceptives, and they include methods such as the IUD as well as injectables. And it's the important concept about LARC is that it's safe, it's effective, and it's also something that you don't have to think about. So with LARCs and its use, teens would be able to get an effective method of contraception and not have to think about it, for example, every single day.
So when we talk about educating teens about contraception, somehow automatically, most of the time we think about girls. Well, what about boys?
Well, it's good that you mentioned that, Tanya, because it does take two to tango. And I think that including boys in education about teen pregnancy prevention is very important. I think they're often forgotten in our efforts. However, they have a very important role to play. One, in terms of just making sure that they also learn about effective contraception and also the use of condoms in dual protection. So both teens, both girls and boys, need to learn about effective contraceptive use. We also need to encourage them and educate them about responsible sexual behavior once they decide to be sexually active.
So this is obviously a topic where more than an individual needs to be engaged. So let's talk briefly about parents and adults in the community where teens live. What are their roles?
Yes, so I think a parent or a trusted adult is critical in terms of the opportunity to prevent teen pregnancy. Teens really look to adults for guidance and for support. And so having that appropriate parent or mentor or guardian who can really help them and educate them is critically important. The other thing too is that teens may actually need accurate resources. and good information. So not only is it important to have teens educated about this information like LARCs, but also to have parents educated. And depending on the context, the providers can also support that environment where parents are allowed to get information and learn and share so that they can be a good first resource of information for teens.
So we're all in this together.
We're all in this together.
Thank you so very much.
Thank you, Dr. Popovic.
Thank you very much, and I hope you will join us next month for Beyond the Data.